Angina, decubitus, or nocturnal angina. Nocturnal at night time. So angina or the chest pain that we observe at night time. This is actually the pain that is felt by the person in sleeping position. When we go to the sleeping position, then we feel chest pain. That chest pain is called as angina, decubitus, or nocturnal angina. Nocturnal, while most of the people they sleep at night, so you may call it nocturnal angina, you may not call it. You can, it is up to you. Okay. So well, the point is, when people actually go to sleep or in a supine position, they observe pain in the chest region. That pain is called as angina decubitus or nocturnal angina. So this is angina that is because of fluid. How? Let's understand that. Very simple. When we are in standing position, what's happening to us? The fluid in our body is actually moving downward. Why? Because the gravity pulls that. So gravity is starts pulling the fluid from the upward region or from our head region to the downward region. So what happens then? Then the fluid concentration starts increasing downward. So fluid moves downward. As we change our position into a supine position, so what happens then is actually the fluid that starts moving back towards the head region. So the fluid now starts moving to the head region. Now this movement of the fluid to the head region causes increase in the load of the heart. So before, when there was a little bit ability of the heart to pump the blood out from the heart in order to provide the blood to the entire body and to the heart itself. What happens now? If a person is already having compromised heart, means there is a certain problem in the heart. So then in that particular scenario, in that particular case, the load on the heart is that much that the heart feels discomfort to pump the blood. So this the condition of the heart becomes worsen further. Okay, there is further worsening observed in the heart's function because heart is already kind of failed. It's not able to pump the blood particularly in a strong way. So now if the fluid is also coming, so this fluid will exert further more pressure on the heart. It will increase the preload. So what will happen then? Then the heart will further go down. So then there will be further decrease in the supply of the blood to the heart and to the body. So especially when there is decrease in supply of the blood to the heart itself, then I have talked about this particular condition, then the pain that generates, how the pain is generating. So coming to the point, when the blood concentration is decreased, supply of the blood is further decreased because of the fluid, then what happens? Then the pain signals are generated in the chest region. So that painful signals, we call those signals as angina, or we call that as pain, and that pain is actually anginal pain. Now this pain is causing the chest discomfort, the chest discomfort. So now this pain is because of what? Because of the fluid. So that's why we call this pain as angina, decubitus, or nocturnal angina. And the very point to remember is that this pain is actually caused by the fluid and that fluid movement. So we are supposed to concentrate on the fluid while we are treating such kind of heart patients. So we will concentrate on the fluid, and then we will use certain medication that will help removing the fluid from the body and etc. What do I mean by etc? According to the patient, the treatment strategy actually changes. So we must not do self-medication, and we must ask certain experts regarding the medicine and etc. That's all. Thank you for watching Dr. UUT lectures.